In pediatric dentistry, we do not handle children as if they are miniature adults. Children are different and have to be handled differently. Now, there are a few things that you have to keep in mind before you take a child to your dental health checkup. The first and foremost thing is, make sure that you tell your child that your child is going to an aunt or an uncle who's going to take care of their teeth and make it good. Do not scare them into saying that we are taking them to a doctor auntie or a doctor uncle who's going to give an injection and pull out teeth, because children hear horror stories both from their parents, relatives as well as friends, and it leaves a very lasting impression on them. And when they come with that preconceived notion that the doctor is ready to pull out an injection and give them. So they will not be able to cooperate with the dentist very much. So please do not scare your children saying that dentist is somebody who is going to hurt them. Rather portray them as people who takes care of their teeth. And second thing, make sure that you tell them the importance of oral health by brushing their teeth twice a day, giving them good nutritious food. Once they come to the dental clinic, make sure that when the doctor, dentist and the child is interacting, please do not interject unless it is absolutely necessary. Because there has to be a bond that has to form between the dentist and the child, and the trust to build so that the child will allow the dentist to perform treatment on the child. We as pediatric dentists have a lot of behavior management techniques available with us. We start with simple demonstrations so that the child understands what is going to happen to them, and we do have a lot of other techniques like videos or models to show them. But what happens sometimes is, once the child undergoes some kind of a painful procedure, they become very resistant to next treatment. So at that point of time, we do have a lot of arsenal. If the child has already had a negative experience, or the child is very young, if it is below 3 years and unable to communicate to the dentist what is the problem, or is unable to follow commands that the dentist is giving so that they can have the treatment done, we have other methods also. We always as pediatric dentists look at what is the quantity of work that needs to be done on the child, what is the amount of treatment that is needed. And if it is a minor couple of procedures, we sometimes practice what is called as conscious sedation, so that the child is not anxious and is able to undergo the treatment. But sometimes when you have multiple treatment to be done and the child is very uncooperative, we also advocate the use of general anesthesia in the hospital, where it is safe for both the patient and the dentist to perform treatment. The question of safety regarding general anesthesia is always asked, but what we should remember is, if you attempt all this treatment on the chair when the child is not cooperating, there is more chances that the child can get harmed. The child may suddenly shake and injure itself. It can aspirate in its attempt to get out of the chair or escape treatment, which is probably what is avoided in the general anesthetic setup. But it is not mandatory that all patients are patients for general anesthesia. There has to be a pre-anesthetic check by the anesthetist who certifies that the child is at minimum risk for general anesthesia. We also get a consent from the pediatrician who says whether the child is at any risk for anesthesia. So only after this we subject the child to general anesthesia and do a full mouth oral rehabilitation, so that the child is able to resume its normal life with a pain-free teeth, so that they can gain back their general health well in advance and be good citizens.